But we begin with a bit of an about face from the CDC on masks.
For months, they've said that masks help prevent you from spreading the coronavirus, but now they say masks also offer some protection from contracting it.
This new guidance comes as COVID hospitalizations have hit an all-time high nationwide. And with the holidays, of course, approaching, a number of states like Minnesota and Iowa, for instance, are cracking down on those large gatherings. Here to help us break down everything that's happening, NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, always good to have your insights, sir. Thanks for your time this morning. So let's start with these masks, because we've known, Dr. Gupta, for months that wearing a mask, it can protect those around you. But now there's this new data that suggests a mask can protect the wearer as well. What changed?
I think it's good morning, Craig. Good to see you. I think it's a recognition. I'm not sure what changed internally on the CDC side, but they were willing to message on what we in public health have been messaging on and have known as clinicians for a long time now. It's why we wear masks of many different varieties when we're caring for patients with COVID-19. It's why when I speak to my patients, I say, wear a mask to protect others, but also to protect yourself. So when I hear this news, it's not shocking to me. It's not shocking to our colleagues in public health. Glad to see the CDC acknowledge the truth that we've all known to exist for the last 9 months.
And Dr. Gupta, the proof is in the numbers. Really, the study also suggests that if 15% more of the population starts wearing masks, we could avoid another lockdown potentially and save billions of dollars. But aside from all of that, talk about how we could potentially save lives. My uncle works in the ER, and he's been texting me for months, for almost a year now, to tell people to wear their masks.
You know, Chanel, I'm glad you raised that. What we do know, and this is from my own Institute for Health Metrics and Evaluation, we've been modeling out different forecasts. What is clear, because in places like the Dakota Plains, masking compliance is about 30 to 40% of individuals when they go out in public, they wear a mask. We know that if there's 95% masking broadly in the United States, we would effectively end this pandemic. We wouldn't need to worry about a vaccine. And we would save 100,000 lives by January 31st of 2021. So that's pretty remarkable, because right now we're on track to lose about 400,000 souls in this country by that time point. We could save a quarter of them if everybody masked up, for the reasons that the CDC has outlined the revised guidelines.
Doctor, the numbers are still staggering. 1 million new cases in just 10 days. So how bad are things now? How bad are they going to get as we get into the colder months? And why aren't we feeling like we did back in March when things were really bad?
You know, Dylan, it's the perfect storm of environmental considerations. Remember, this pandemic started in March, April, when it was getting temperate, and then throughout the summer we saw a second wave. Now we're dealing with cold, dry air everywhere. That's what influenza, but particularly COVID-19, likes in terms of propagating in the environment. Respiratory viruses like cold, dry air. So that's one. Two, to your point, Dylan, children are back at school in many parts of the country for at least part of the week. We have college-age students on campus, and they might be going home for the holidays for Thanksgiving. We're really concerned about that. I've seen indoor data from Open Tables suggesting people are dining indoors at the highest levels throughout that we've seen in the last 9 months. So there is a certain degree of normalization in American life, even if we may not feel that way. That is why we're seeing these spikes. 62,000 new hospitalizations just in the last week, Dylan. So this is not just cases. This is hospitalizations, and deaths are spiking in 27 states. We're estimating that ICUs will be overloaded at least in 18 states by the turn of the calendar year. So this is unfortunately going by way of the models, which unfortunately have been correct up to now.
Dr. Gupta, of course, we're just a couple weeks out from Thanksgiving, and now the CDC's got some new guidance for Thanksgiving, and it emphasizes that the safest option for the holiday is celebrating only with people in your household. However, if you do celebrate with others, what precautions should you be taking, Dr. Gupta?
You know, Craig, this is such a difficult question, because we're all exhausted by this. We all want to see loved ones, families, and friends. What I would say is, if you must see other loved ones in the same city, do it outside. Do it outside next to a fireplace, an outdoor fireplace, or a heater. seen restaurants really innovate in this space here in Seattle. Lots of heaters, lots of fire pits, things of that nature, outdoors, with just, say, one other couple, if you're dining as couples, just one other family at most. I would not have this large gathering. So that's one recommendation. Another is don't get on a flight. And this has been we've been toiling with this in terms of those of us with platforms, those of us in public health. Do you get on a flight? Do you not? Truth here is you could do all the right things, but if you don't have an N95, if you don't have testing on the front end and then also on the back end, if you're not willing to mask in person with your loved ones for at least 72 hours, if you don't wear an eye shield, things that are tough to do, especially getting an N95, because they are in scarce supply even for medical workers, you shouldn't get on a flight, because surgical masks, or medical type masks, these blue masks, these are the types of masks I would recommend most people wear. We know that now there are cases of outbreaks on flights, even if you're doing all the right things with masks like that. So I would say stay at home, don't get on a flight, try to eat outdoors if you have to meet with people outside your family.
Dr. Gupta, always useful information. Thank you, sir. Thanks as always, Dr.
Thank you.
Vin Gupta. We'll let you get back to saving lives.